Joining us once again to answer your Facebook questions is Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning to you again, Lieutenant Governor. Thanks for joining us.
Good morning.
Good morning. Okay, the first question, Lance is asking, can the virus enter your body through an open cut? And if you have an open cut or wound, is it possible to get the virus in the ocean?
It's very unlikely. The ocean is a very unlikely source for viral transmission, especially COVID-19. It requires surfaces, and it's just not likely to survive there. Also, it's mucous membranes usually. I'm not saying that you couldn't get it through a cut, but it's mostly through your mouth, your nose, and your eyes where you have mucous membranes. That's where you're likely to get the virus.
Okay. The next viewer, Sherry Conda, asking how many people have gone through and recovered from this virus? How did they recover? And what is the best advice to those who are tested positive?
Well, the best advice for those who are tested positive is to absolutely stay home in total isolation from anybody. Do not be in contact with your loved ones. Be at least 6 feet apart and wear a mask at home. It's also good to, once you've recovered, which takes time. Time is the only thing really that we know will do it. Once you've recovered, the symptoms usually last 5, 6, 7 days. Then the viral load drops, and you should get a test and test negative before being considered done with the virus. You need a negative test to be sure. That's really the safe way to go. In some places, they've asked for 2 negative tests on consecutive days.
Okay, another question coming from our Cajun 2 Facebook page from Rena Liu. How do we effectively flatten the curve once stay-at-home orders and travel bans cease? What will life look like for the next year or so as we try to resume, quote-unquote, normal day-to-day activities such as work and school before there's a working vaccine?
Very, very smart question, as all of them are. What it will look like is this. After we get to April 30th and have flattened the curve because we've been doing a relatively good job in staying at home and self-isolating, there'll be very few cases in Hawaii to spread, and we'll still have no tourists coming in. At that point, what I plan to do is make recommendations. I've already begun these with very sharp people across our state departments, and including General Har. We will ask people, I believe, to get a test before they come into Hawaii to demonstrate that they either already have antibodies and have gone through it and are clear of the virus, or a test within 2 days that they are negative. That way we can know that travelers are very low risk. We'll also give extensive screening, like temperature tests at the airports, and a lot of information so that if anybody develops any symptoms whatsoever, we immediately surround them, check them, and test their contacts. So we can flatten this curve right now over these next 25 days through the end of April, and then we worry about slowly bringing back the economy and making sure no one comes in positive.
Now, Dr. Green, you mentioned the end of April. That brings me to my next question coming from Jennifer Chang. She's asking, Dr. Green, do you recommend that the state should extend the April 30 stay-at-home order to a later date?
What I want to do is, I think about 10 days out, about April 20th, we should make that determination. We should see exactly the number of cases, exactly how many ventilators we've had to use, and how much time we have people in the hospital, see how low our cases have gone and whether there's any community spread. Eventually, we obviously have to return life somewhat to normal, though maybe a slightly new normal, and we obviously have to return our economy to some semblance of health. So we will eventually lift the stay-at-home order, but it will depend on specifically the numbers because we do not want to have fatalities. I think if we do a great job through April 30th, we'll begin to relax the social distancing and we'll begin to relax the stay-at-home orders quite effectively.
Okay, but it sounds like you're going to wait at least 2 weeks to make that determination whether you're going to recommend to the governor to extend that stay-at-home order.
That's right.
All right, thank you so much, Dr. Green, for joining us once again.
You bet.
And we